The following is an exploratory analysis of the Special Interest Tract, a resident-driven longitudinal elective. My name is Ursula Barghouth.
And I'm Lindsay Smith, Family Medicine Residents at Beaumont-Grosse Pointe. Thank you for the opportunity to present our research.
The Special Interest Tract provides residents with a framework to develop a curriculum based off their unique interests. It is, to our knowledge, the first report of a resident-developed, resident-driven longitudinal elective embedded within the family medicine curriculum. While there have been reports of longitudinal electives and interest-based research tracks, there are no reports of interest-based clinical curriculum. This curriculum combines independent study, mentorship, and hands-on clinical experience. It's designed to enrich the education and professional development of the resident and to enhance the depth and scope of the residency program. In creating the Special Interest Tract, we considered the following aims and objectives in designing the curriculum. To develop a standardized format that will allow for flexibility to incorporate creativity in the curriculum design. To minimize administrative burden on residents and faculty participating in the Special Interest Tract. To incorporate an evaluation process that ensures the resident is meeting family medicine requirements, is progressing through the Special Interest Tract, and that evaluates resident wellness. And to continuously collect and analyze data to evaluate and improve the curriculum. The framework for the Special Interest Tract will be presented in detail elsewhere and is summarized in the graphic on this slide. Most components can be reviewed at your own pace, however, I did want to highlight a few. The goals and objectives are developed by the resident and periodically reviewed and updated as the resident progresses in the tract. The clinical experience should encompass both the scholarly activity and at least 200 hours of clinical learning over the span of 2 to 3 years. Checkpoints are a key component to the curriculum that will be performed at 6-month intervals. It assesses resident wellness, progress towards graduation requirements, evaluation of the Special Interest Tract experience and update of goals, and a review of milestones and evaluations. It will be used to recommend if a resident can continue at the current pace or if adjustment is needed.
Prior to launching, we distributed surveys using Qualtrics to residents and faculty at Beaumont-Grosse Pointe Family Medicine Residency Program. The specific aims of the survey included assessing for interest, intent to pursue a track, and to evaluate for any barriers to participation. We had a response rate of 45%, which was fairly evenly distributed between PGY 1, 2, 3, and attendings. This allowed for a good representation of the program as a whole. Evaluating our aim, intent to participate, nearly 2/3 of our respondents rated this highly likely. The mean for faculty was slightly higher than residents. We did recognize that participation would encompass different responsibilities for residents and versus faculty, but overall, interest was apparent. Residents were then asked to rank the following as factors that may impact participation. From most important to least important, these factors are that the track had already been developed, there was a faculty mentor championship already established, independence and self-directed learning opportunities, other residents were currently in the tract, an opportunity to create something new, or other residents had participated in the tract previously. While most residents seemed to prefer a tract was already developed, 3 respondents ranked having independence and ability to create something new as the most impactful factor. Interestingly, there were no residents that had ranked having another resident currently in the tract as their number 1. Residents were asked to give additional comments on potential barriers. Overall, themes included additional workload, time commitment, and limited staff, as well as meeting graduation requirements. An interesting perspective was the fear that this would increase clinic burden on other residents who were not participating in a special interest tract.
We asked residents to rank their perception of the Special Interest Tract on intended goals as shown on the screen, using a scale of 0 being unlikely and 5 being most likely. Though all intended goals ranked highly with an average score ranking above 3, resident wellness and leadership skills ranked lowers with means of 3.1 and 3.7 respectively. There was also the greatest variability seen in these 2 categories. We then asked residents to list other potential positive impacts. There was an overwhelming response to positive remarks as listed on the slide and as summarized on the table in the next slide.
Overall, majority of responses expressed interest and intent to participate, as well as a positive impact on all intended goals. The low-ranking impact on resident wellness was likely due to the respondents' perception on added workload versus the ability to perform meaningful work. Based on responses, participation is likely to increase if tracks have already been created. However, the framework still allows for residents who want the freedom of creativity to explore it. The table shown on the screen summarizes the basic themes of benefits and barriers that arose from the survey as discussed previously.
Since implementation, we launched tracks in wound care and sports medicine. Residents additionally proposed tracks in behavioral health, community medicine, women's health, and osteopathic manipulation. The study was limited by sample size, however, common themes and barriers identified were incorporated in the framework prior to implementation. While the field of family medicine easily allows this type of program, it may be difficult to generalize to other specialties. Given that some respondents were not likely to participate, participation should be on a volunteer basis. Further studies will utilize wellness surveys, performance metrics, participation data, and alumni surveys to create a standardized and reproducible implementation process and to examine the impact of the special interest track curriculum. We hope the special interest track gives residents the opportunity to incorporate their interest in training, take an active role in shaping their career, to network with professional mentors who share their interest, and to develop leadership skills, preparing residents for the career they envision. Doing so can increase the chance to perform meaningful work in their future careers, which is inversely proportional to burnout. We also anticipate the special interest track will encourage innovation and leadership and training that will be translated into the physician workforce. Thank you for your time.